I am Dr. Alim Akhtar Bhuiyan. I am a senior consultant neurologist and coordinator of the Department of Neurology at Apollo Hospital, Dhaka. Today I'll be discussing about one of the very important neurological disease which is called Parkinson's disease. Parkinson's disease is a chronic neurological disease. It is actually a progressive disease. That means the patients who have Parkinsonism, they get worse over time, and it happens because of it is actually a neurodegenerative disease. That means some of the neurons or nerve cell, they are destroyed in certain portion of the brain. Actually, the dopaminergic cells that are present in the basal ganglia, that is the substantia nigra in the midbrain, and the basal ganglia cells are affected. These nerves and the dopamine is responsible for smooth functioning of the motor system, so that we can use our hands and muscles, we can walk properly. And if these cells are destroyed or damaged, then we cannot function properly. And 4 to 6 million people in the world are affected by Parkinson's disease, and 50 to 60,000 new cases are diagnosed in the United States. And it affects people who are getting older, and actually most of the cases are affected in people who are 50 years or older. And sometimes we can get this disease in younger people in their 30s or 40s, but they are not as common. And it is a disease which is sporadic. That means most of the time it does not affect the family members, but in some cases, that is 5% cases, it can also affect family members. And there are 1 to 10 Parkinson's genes which are responsible for the transmission of the disease in the families. Again, there are different types of Parkinsonism. Most common is idiopathic Parkinson's disease. Next is vascular Parkinsonism, when the patient's legs are more affected and they have problem with walking. And there is secondary Parkinsonism, which can be caused secondary to some cause, like some drugs can cause Parkinsonism. And also there are Huntington's disease, Heller-Boden-Spatz disease, Wilson's disease, and normal pressure hydrocephalus, etc. And there is again another type which is called Parkinson's plus syndrome, when the basal ganglia is affected and the other systems of the bodies of the brain is affected. Examples are OPCA, olivopontocerebellar atrophy, striatonigral degeneration, Scheidegger's syndrome, PSP, progressive supranuclear palsy, cortical basal ganglia degeneration, etc. Why you need to differentiate between the types? Actually, we need this differentiation because the treatment is different and the response to treatment is also different for different types of Parkinsonism. So what kind of symptom we get in Parkinsonism? Actually, we can divide the sign symptoms into motor symptoms and non-motor symptoms. Among the motor symptoms, patient can have bradykinesia, that means slowness of movement. They become very slow, and they have tremor, which is not affecting everybody, and it can affect one side of the body and then it can spread to other part. And patient can have cogwheel rigidity, stiffness in the limbs. So all this can cause problem with different function. And also patient have loss of postural reflex. That is, the patient can have problem with walking and balance. So as the disease progresses, patient has difficulty. Again, there are 5 stages of Parkinsonism, and finally in stage 5, patient becomes wheelchair bound. In stage 4, patient walks with a walker, and over time patient gets worse in spite of treatment. And again, the motor symptom, patient can have difficulty with writing. He can have facial expression problem, and he can have slurred speech, and also in the long run patient can have swallowing difficulty. In addition to the motor symptoms, patient can have non-motor symptoms, and the non-motor symptom can include loss of smell, and in the long run patient can have problem with memory, short term, intermediate term, and in the long term memory problem, and they develop dementia. And patient can have problem with sleep, they have behavioral disturbance, psychosis, and a lot of them, they have apathy. That means they are not interested, they are not happy, they are not sad, and they can also develop depression. And sometimes they can have constipation. It is a part of the disease, dryness of the skin, and they can have urinary frequency and urgency and erectile dysfunction. So all these are non-motor symptoms. And how we diagnose this disease? Actually, there is no specific diagnostic test which can confirm that patient has Parkinsonism. Actually, the disease is diagnosed by its signs, symptoms, and a neurologist can discuss with the patient and his family and diagnose this disease through signs, symptoms and examination. And there are other tests which helps to rule out other disease which can mimic Parkinsonism. So imaging is sometimes helpful, like we do MRI of the brain to rule out any other causes which can cause Parkinson's like sign symptom. But it is not essential. It is a very helpful test to rule out other causes of which can cause Parkinsonism, like subdural hematoma, brain tumor, whether patient having stroke, or NPH, normal pressure hydrocephalus, etc. So how we treat this patient? Treatment, actually there is no cure for the disease. As the patient develops the symptom, we can help in symptomatic improvement. First line drug we use is carbidopa-levodopa combination. Actually, as I was mentioning, dopamine is decreased in this disease. So if the dopamine is sent to the brain, it helps in symptomatic improvement. So as dopamine cannot reach the brain alone, we always give carbidopa along with it. And there are different types of levodopa-carbidopa combination. We start with a low dose and build up the dose slowly. And there are other dopaminergic drugs, second line drug, which are available in our country. One is bromocriptine, pramipexole, ropinirole, rotigotine patch, and apomorphine are not available in our country. We slowly increase the dose and slowly. And again, there are COMT inhibitor, catecholamidyl transferase inhibitor, which helps in improvement of the function of levodopa and carbidopa. And again, we use the anticholinergic drugs. There are several types. It helps in treatment of the tremor of the patient. Again, we can use the MAO-B inhibitors, monoamino oxidase inhibitor. There was initially selazilin, now resazilin is also available in our country. It also helps in symptomatic improvement and also helps in decreasing the progression of the disease. Also, you can use amantadine, which helps in motor fluctuations as the disease progresses. And what are the complications of this medicine? What we find that carbidopa, levodopa, if we use over time, after 3 to 5 years, this medicine does not work as much as it worked initially. So we get the motor fluctuations like dyskinesias, freezing of gait. Then you can have freezing of gait, of dyskinesia, on dyskinesia, yo-yo effect. So these are the problems, and it becomes challenging to adjust the Parkinson's medicine. And so in that case, we have to use the different combination of the medicine used in Parkinsonism to decrease their side effect. And sometimes it becomes challenging to adjust this medicine. Sometimes the patients with advanced Parkinsonism, they need to be admitted to the hospital to adjust their medicine. Also, sometimes patient can have psychotic symptoms, restlessness, behavioral disturbance, sleep disturbance, and these patients also need to be brought to the hospital to improve their symptoms so that they are livable at home. And as I mentioned earlier, these patients can have other non-motor symptoms, and this can be treated with different types of medicine. These patients can have constipation, which can be treated with medicine, or also modification of their diet. Their sleep disturbance and behavioral disturbance and psychosis needs appropriate medicine to treat this. And sometimes these patients can have urinary and erectile dysfunction, which should be treated with appropriate medicine. So now I'll discuss about the DBS. Some of the patients in the long run, they don't respond to medicine, and they can be treated with deep brain stimulation, which is not available as yet in our country, but it is available in the Western world. It is a functional neurosurgery. It can be used in only some kind of patients with Parkinsonism, especially those patients with Parkinsonism stage 3, stage 4, in the advanced stage, and they responded properly to the dopaminergic drugs. And they develop the motor fluctuations, stage 3, stage 4. That means they did not respond to the dopaminergic drug as before. So it is a special medical device like a pacemaker, which is placed in the chest wall, and they have thin flexible wire which are called lead, and these leads are placed inside the brain in 3 areas, and it blocks some of the brain messages that cause the motor symptom. It is a specially highly technical procedure, so it can be done in some patients who develop motor fluctuation. Again, this needs to be programmed properly for getting the appropriate and proper benefit. Thank you.